Hello, and welcome to the Academy of Doctoral PAs podcast series. This podcast series is intended to give information on current doctoral PAs in their professional capacities. In addition, this podcast series is meant to give an overview of the different options for doctorate degrees for those considering the doctorate PA route. If you would like to hear future podcasts, please subscribe to our channel. If you would like to be part of the ADPA, please visit our website at www.padoc.org.
Hello and welcome to those listening. Today I have Dr. Jerry Erickson from Brenau University. He's going to discuss with us the PA doctorate. So why don't we start by having you tell me a little bit about yourself?
Okay. My name is Jerry Erickson. I am the current treasurer of the Academy of Doctoral PAs. I've been a PA for the last 17 years. I've been in PA education for the last 8 years, and I've worked in clinical practice with family practice and urgent care. And I'm currently starting a position as a principal faculty with Brenau University in Gainesville, Georgia. I went to undergrad at University of Nevada, Las Vegas, and PA school at Emory University. I achieved my doctorate of medical science at the University of Lynchburg last year.
Well, thank you for giving me a little bit about your background. Can you tell me a little bit, Dr. Erickson, about the PA master's degree versus other degrees, including other professional doctorate degrees and the current PA professional doctorate degree?
Absolutely. And per the latest physician assistant education data, it's version 35 that came out just recently, PAs are conferred a median of 112 and 112.7 graduate level semester credit hours. So that's, the average of 28 months. Per the Bureau of Labor and Statistics website, the average master's degree range is between 30 and 45 graduate level semester credit hours, with the median being 37. Now for doctorates, specifically the PhD, the range is anywhere from 90 to 110. But that includes time for research and dissertation, which is about 3 to 5 years. Looking at what PAs currently are doing for training and education and other professional degrees or even the doctorates. We said that PAs are close to 113. Physicians with MDs and DOs are approximately saying with 4 years of 125 to 130 on average graduate level semester credit hours. Of course, then they have residency. PharmDs is about the same. The dentist or doctor of dental surgery is about 97 to 120 is the range. For physical therapy, the DPT is about 110. For psychologists, either a PhD or a PsyD, it's average of 110 to 115. Podiatrist, 100 is the average. And nurse practitioner, for the doctor and nurse practitioner, the national average is 72. So PA education, as it already stands as an entry-level master's degree, is in line or on par, specifically more credits given than most of those professional doctorates. So it's already there.
So for those of you out there listening that aren't familiar with institutional and disciplinary accreditation processes, professional doctorates embrace a wide set of degrees, and there is a significant variation within individual degrees, just as Dr. Erickson pointed out within the PA master's profession. You can have a master's of PA studies, and you can have a master's of medical sciences. The professional doctorates are no different. In order to satisfy criteria for a professional doctorate, there are 3 core characteristics and expectations for professional doctorates. The first being that it addresses an area of professional practice where other degrees are not currently meeting all employer needs. Secondly, it emphasizes applied or clinical research or advanced practice. And third, it includes in its rank leaders of the profession who will drive the creative and knowledge-based development of its practices. So with that said, just for those listening that aren't familiar with the academic setup of American U.S. institutions, there are 3 types of doctorates. There's the PhD, which will always have a dissertation and a preliminary or qualifying exam. It typically has 96 hours of coursework, including the research component. And then there is the professional doctorate. You can have a capstone professional doctorate, and if that's the case, then there are typically a dissertation or a project that is done with it. That one is not usually directly related to licensure, but then there is also a professional doctorate without a capstone experience. And for that program, as a result, there is no dissertation required for it. So there are variances between them, but in general, both with the professional doctorate capstone project and without, it's typically 2 to 3 years after bachelor's degree requirements are needed.
And I'd like to add that United States, professional doctorates, as defined by the U.S. Department of Education, there is a specific National Center for Educational Studies, are degrees that require a minimum of 6 years of university level study. That's any pre-professional and bachelor's or whatever things you need prior to that, and meet all the academic requirements for professional licensure in that discipline. So we all have bachelor's before going into our PA program. That's a requirement now. And every PA program confers a master's. And so it's 28 years and 28 months is the average. And so the 4 plus that's over 6 years. So we already meet the requirements for this professional doctorate, according to the U.S. Department of Education.
So to recap, PAs are already earning enough credit hours for a professional doctorate degree. In addition, PAs meet all basic criteria necessary for a professional doctorate degree. In my opinion, the question should not be so much as to whether or not the PA degree needs an entry-level doctorate degree. The question really should be why we're not already getting the degree we're earning. So my follow-up to that would be, if current PA master's level programs were to convert to an entry-level doctorate program, would there be a lot of change to the program structure, length, and price?
That is a matter of subjective opinion. I will tell you that some of the research that is out there that to add some of the specific courses would not be if it wanted to. But as stated, that according to the U.S. Department of Education, there may not have to be a lot of changes. And if you have, say, you want to do a further project or a little more higher level education, it might extend it by a semester at most for most programs. And the average, as I said, is 27 and a half months. I just rounded to 28. But the longest, there's some programs that are already 3-year programs for master's level BA degrees. So in order to confer the doctorate, whatever it has to do with their specific institution, their regional and national accreditation programs, it may be very minimal in changes. And if there's no change in the time or the amount of credits that are conferred, because as I stated earlier, the average master's degree conferred by PAs is higher than most of the doctorates. So if you're meeting all the requirements, it may not extend the time and it may not extend the cost. So that may not be an issue for some places. And some it may, depending on what those specific requirements are of accreditation. If they have to have a little higher amount of time, then it may confer a little more cost. But overall, it should not.
So what's your take on why PA programs haven't converted to direct entry doctorate programs already?
I believe as the professional doctorate for PAs specifically, with the Doctor of Medical Science and the DPAS that have come out just in the last couple of years, because they are fairly new. The master's degree for PAs only started in the very early 90s, and from then it progressed to where all programs now have to have a master's degree. The first PA program only conferred a certificate, and many programs stayed that way and even conferred an associate degree, and then there was a mandate for bachelor's and so on. But it does not negate any of those because they are still grandfathered in. They can still have their state license and national certification for those who already have that. It's for those who wish to have that, and I think it could be a progression if those programs that want to voluntarily create a doctorate, entry-level doctorate program, And according to the ARC, they have no specific qualms or issues when requesting that as a potential in the future, then that should be voluntary. And if it progresses just as it progressed from the master's to from the bachelor's to the master's, I don't think it will be an issue. It may have an issue with those who don't think we should, and for those specific arguments that are out there against the doctorate, which that is mainly opinion based.
Thank you for that. So to recap, what you're saying is that those currently in practice that don't have the doctorate, because of the current standards of the master's and prior bachelor's and certificate, it's not a matter of not being able to practice without the doctorate. It's more of having the degree reflect the education we are conferring.
Correct. And absolutely, because it does not, people worry that, oh, well, if I don't get this was even the argument was before, if I don't get a master's degree, then I'm going to lose my license. No, that's not true. And all of that kind of goes back to, unfortunately, money, because reimbursement. And if obviously, maybe it can be lobbied to, if you have a doctorate, you may be able to have a little more in reimbursement. That's, further down the line and a long-term goal. However, for reimbursement, it has no specific issues. If you have your national certification and your state license, then you meet all the requirements to fill that specific job and role. And having the degree is not going to prevent you or not having that. However, the progressive thought is to have those, to have seats at the table, to have help lobbying reasons, and to help promote and progress the profession with parity and equity, and for those patients that need it in the end.
Thank you for that. Dr. Erickson, can you explain the background of using the doctor title in clinical practice in the U.S. versus other countries?
Absolutely. The title of doctor, it does not belong to MD and DO alone. They are physicians, and they own that specific designation and title. Physicians actually adopted the doctorate even to the degree conferral only a little over 100 years ago, as doctor is known to be a conferral of a degree to those who are top of their field with education experiences. And so within the clinic, clinical setting, there is no specific reason why that PAs shouldn't be able to. If you look at the perception issue of why they may be able to not use that, is because of the thought that we are not, or that we're trying to encroach on territory that is not ours. We are not trying to impersonate physicians. We are PAs. But if we've earned that specific degree and title, why should we not be able to use the designation? If, yes, people say maybe it's only in the academic setting. However, look in the clinical setting and the other clinical doctorates. Audiologists, pharmacists, psychologists, physical therapists, podiatrists, dentists, veterinarians. They all have professional clinical doctorates, and there's no specific qualms with them being called doctor because they've earned that degree and title.
So in essence, a PA using the title doctor in clinical practice is, by very definition of the term, doctor, not impersonating a physician.
Correct.
So what is the reasoning for prohibiting PAs from using doctor in clinical practice?
As I was saying, it's the specific perception, and there may be whatever the lowest common denominator may be at a specific clinical or institution that doesn't allow it, because there's that perception of impersonating physician, and we are not, as I stated. In a clinical setting, because they want to avoid confusion. I understand that. But if it's a clear designation on your name badge and how you describe yourself, they're all state laws require that we have to, state that we are a physician assistant when starting to talk to a patient. That's not going to change. But if the patient chooses, and just as I have way before I completed my doctorate, patients would completely and constantly call me doctor. Even if I reminded them that I do not have a doctorate, they said, no, you are my doctor. So the perception of impersonating a physician, which we are not, it's To me, it's all about patient care. And if that's the designation that they want to, and if as long as the institutions have it clearly designated that who the physician and what the roles are, and if the specific professional organizations and states have a better public marketing to where what these specific professions are. And I understand it's a public perception that, oh, doctor means physician. That's not true because there's so many other doctors. And people think that, oh, well, in a clinical setting, the doctor should be the physician who is the head of the team. Well, in a team-based, everyone should have a specific value. And if you've earned the conferral of the degree, you should be able to utilize the title.
So if we have discussed that tradition largely decides currently in clinical practice who is using the doctorate title and who is not, and that the doctorate title does not specifically label an MD only in clinical practice, do you think there could be some issues of competition that physicians are concerned about with other healthcare professionals having a doctorate title?
There is a potential for competition from thought perception from the physician groups because of the non-physician providers coming in, but they think of those specifically medical providers. However, is a psychologist not a medical provider? Is a podiatrist not a medical provider? Is a psychologist? And these are all in the human, clinical settings. And there's this perception that, oh, it's encroachment onto their territory or their potential reimbursement ability and whatnot. And that's not true because we're trying to work together as a team for the end product of patient care. And it shouldn't be down to misperceptions and beliefs of personal subjective ideologies of territorialism, because the territory should belong to the patient, and that's what we're here for. But if you've earned the degree, you should earn the title.
Thank you, Dr. Erickson. So I'm going to use that as a segue into my next question. There has been a lot of pushback both in professional groups, PAs, physicians, etc., that those professionals who primarily earn their doctoral degree online, such as the current DMS portion of the PA doctorate degree, that those professional degrees are not as good as other professional doctorates, such as the MD or the DO. Can you please give us your thoughts on that?
Absolutely. For training and education, degree conferrals, there's certificate programs, associate programs, bachelor's, master's, and other doctorates. Now, as far as the point of view, as far as online, and according to a U.S. Department of Education above us, we state, they are as far as the amount of degree credits and what we earn. But looking at an online article in the STAT from 2018, close to 25% of medical students don't even attend class in person. They rather watch lectures at home, and then they come in for testing and other things, which is basically an online delivery. Well, the doctor and nurse practice is almost exclusively a remote and distance learning program, with very few having a very minimal in-person requirements. So it's very on par. And all those doctorate programs now that are for professional doctors, those who already earned their title of physician assistant for certification and licensure, have gone back to promote more and learn more and get a higher degree, is the same way. So it should be interesting to note for the current medical students, and this was the argument, they're all online. A quarter of medical students just 2 years ago, and it's probably higher now, especially in the era of COVID, are taking most of their courses online. So what's the difference?
An excellent point. Thank you for that. So Dr. Erickson, with the DMS degree, can you obtain tenure status at an academic institution?
Absolutely. And I would say you can obtain tenure status at institutions without the DMS. I know some physician assistants who are in education that have a master's degree that are tenured. It all depends on that specific institution. There's a varied amount, and you can look at the PAEA's program report on all the information, because not every institution offers tenureship, and there is a progress, and for promotion you could be different levels, whether you come in as a lecturer, go into an assistant professor, associate, and then professor. That isn't always online with tenureship, but it depends on that specific institution. Because if it's a classification for Carnegie and research institution, the highest one being R1, they give way more credence and value to research doctorates, as we talked about earlier, like for the PhDs and EDDs. Now, as I said, it depends on that, because I know some programs that offer tenureship to masters, but it all depends on what that specific institution. Where I'm currently at, I am not currently offered tenure, but I am offered the ability for promotion within going from assistant to associate. So, and after a certain amount of time and meeting the requirements, I can then apply for the next level, which is full professorship. And if they change their mind, they may offer tenureship, but that's completely up to the institution.
Okay, thank you for that clarification. Can you explain how you funded your doctoral degree?
Absolutely, and this is something that some people think is potentially cost prohibitive, or is going to limit certain people to get in, and that's not true. And because you already have a degree, and going further, I use student loans. I know some people that saved up or they paid up as they went. It should not be overly cost prohibitive. I used the federal Stafford loans for graduate school and was able to get that, and I'm making payments now, and hopefully we'll have them paid off by the end of this year.
Well, great. Thanks for explaining that for us. What do you think the role of the ADPA has for our profession?
Well, I see the ADPA as a source of collective knowledge, experience in the matters pertaining to the progression of the profession, as all the members will have a doctorate level education with experience and knowledge to share, and those who are interested in becoming a doctorate. So we're not exclusive to our membership. And as a group that can help foster relationships between different organizations to assist in matters pertaining to the profession and healthcare in general. These include those national PA organizations for accreditation, education, and certification, to build and help foster bridges with the educational programs that currently exist and the further development of shared interests between those programs, to be able to assist in ways that perhaps that could be a conduit that otherwise be difficult or not attainable from those specific organizations themselves.
Well, thank you for explaining that for us. And that concludes our discussion with Dr. Erickson today. Thank you very much for joining us and explaining to us a little bit more about the PA master's degree and the newly developed PA professional doctorate degree. Thank you.
Thank you very much for having me, and this has been an interesting discussion, and I look forward to further progression of the profession.
Thank you.
And that brings our current discussion to a conclusion. If you would like to hear more from the ADPA and future podcast series, please subscribe to our channel. If you would like to become a part of the ADPA, please visit our website at www.padoc.org. The website contains up-to-date information and news on the PA profession, as well as specific information for doctorally trained PAs and those wishing to explore doctorate degrees. Thank you for listening to this podcast.